Alright, let's go. On the background is Two Steps from Hell. They're epic. I'm talking about epic. Alright, so we're going to start talking episode 106 today, and it's on ADHD and psychedelics, microdosing psychedelics. Part 1. First-line ADHD treatments in adults mainly include pharmacological intervention. Alexa, turn it down. To enhance dopaminergic and noradrenergic neurotransmission within the stimulants, such as methylphenidate, which is what I'm taking, and amphetamine, which is Adhd, and non-stimulant agents such as Vyvanse. So they're called pro-drugs. If you look up pro-drugs, you understand what that means. It only metabolizes in your body once it's ingested. That's it. Overall, they have been proven to work effectively in adults with ADHD. This includes fast symptom relief and thereby enhancing the person's quality of life. In the longer term, as shown by prospective studies, approximately 20% of ADHD patients discontinue their prescribed medication after 6 to 9 months, 30% after 1 year, and half of them after 2 years. And there is by Bejerot. It's in the description. You can see. I don't know if that's accurate, but I don't know why people would stop taking ADHD medication if they, if it helps. So, failing to respond to ADHD medication is being associated with a lower quality of life. Alternative options need to be explored for the subset of adults with ADHD who do not benefit from or do not adhere to the first-line pharmacological treatments, such as medication, as well as cognitive behavioral therapy, so CBT. The use of classical psychedelics like LSD in small quantity doses, repeated doses, is known as microdosing. From now on, I'm going to call it MD. Or whatever, has been suggested as a potential alternative in treating ADHD symptoms. Previously, it was shown that one of the motives for people who microdose was to self-treat their ADHD, a practice they deemed more effective than taking conventional first-line pharmacological treatment and act like prescribed medicines. General claimed effects of MD include increased concentration, productivity, and enhanced positive mood. Placebo-controlled research in neurotypical volunteers has shown that a single small dose of LSD improved attention performance and increased positive mood. After repeated dosing in older participants, this is cool, changes in time perception, which I will talk about afterwards, were observed after the fourth dose. While the effective profile of a small dose of psychedelic in healthy volunteers and the user claims about symptom relief in ADHD seems to point in the direction that ND can actually help in the treatment of ADHD. Research is definitely needed to show behavioral changes before and after microdosing in adults with ADHD. This approach will address the shortcomings of the studies, asking users retrospectively about their experience with microdosing. All right, see you guys next episode.